Hello, everybody. Welcome back. Today I'm going to be going over things that you need to do or how to prepare yourself to when you go to the dentist, when you go to your appointment for the first time. I'm going to go over maybe 5 things that are necessary that you should bring with yourself, and also things that you should tell your dentist when you go to your dental appointment to make sure that you get the best service and the doctor can take care of your full mouth the best way possible. So, to start off with number 5, and before I start, actually, just to remind you guys, I'm not a dentist. What I do have is just a lot of experience. I've been in the dental field for well over 10 years, doing sales, treating patients, educating people on what it is that they have in their mouth, what it is that cause these situations, how to take care of them, and more importantly, how to prevent them from happening in the future to reduce costs in yourself. So, again, without further ado, number 5. So, though obviously the most important thing you should have in a doctor or any dental practice is your ID. When you go to your dentist appointment, you always make sure that you have to bring your ID. Now, if you don't have your ID, obviously the doctor doesn't mean the doctor's not going to see you. He's still going to see you, but it's very important to bring your ID. And along with that, just to add to number 5, is if you have insurance, your dental insurance card. Now, if you don't have your dental insurance card, and this tends to happen a lot, if you don't have your dental insurance card with you, or if you have an insurance card, make sure that the one that you have is for your dental, because most times than not, your insurance card that you get from your employer does not sometimes doesn't come with the dental insurance information. Now, it doesn't mean that the person who takes care of insurance at the dental practice is not going to be able to find it. It just makes it a lot easier and a lot faster. And if you can give it ahead of time prior to you going to your appointment, then it gives them more time to look for it and make sure that by the time you get there, that everything is taken care of in terms of your insurance. Okay, so going on to number 4. Number 4 is your medical history. If you have any allergies, if you have any sicknesses, if you have a primary physician who has your medical history, it is important that you inform the dentist. Normally, they have an intake sheet that you fill in either at the location or they have it online and you fill it online. Make sure you have that information. Also, very important is if you're taking any current medication. It could be even if you had an emergency and you had to go to the hospital and they prescribe something to you and then they might for pain in your mouth, they might then tell you to go to the dentist. And if they give you something, it is very important to tell the dentist that, because one, you don't want to you don't want to pay for medication for the same medication twice, and two, you don't want to be overdosing on a medication, because it can be dangerous depending on what it is that you're taking. So it is very important to tell your dentist all these things. In addition to that, if you have any allergies or certain medications that could have an effect on you, a bad effect on you when you take that medication, so it is important to tell the dentist. That way, he can prescribe something different that won't affect you in any bad manner. Number 3 would be your symptoms. You make sure that you inform your dentist of your symptom. How your pain is. Is it 1 through 10? Where is it specifically? How long have you had it for? Which is very important. Because there are times where I have had patients that have come to the office and I asked them, how long have you had this pain for? And some people have told me that they don't remember, and I'm like, oh, wow, that's a really long time. Or they'll say a month, and it's like some people have a very high tolerance level for pain, and others don't. But even if you don't have pain, what's bothering you? What makes you feel uncomfortable? What don't you like? All these things are super important to inform your dentist. Do not make it a guessing game. Do not go into, oh, well, he's a dentist, he should know. No, he's not gonna know, because he's going to just see what is wrong inside your mouth. Just like any other doctor, they're going to ask you questions, and the reason why is because they have to pinpoint specifically what it is that's bothering you. And now, for a dentist and even for a doctor, sometimes it has nothing to do with pain. Sometimes it could just be with the way you look. So sometimes you don't like the way your teeth look. To you they might feel small. To you they might feel big. To you they might be discolored. To you you don't like the way they're shaped. There's 1,000 things that have nothing to do with pain, and in those situations, you want to be able to take care of that. You want the dentist to be able to take care of you and make sure that when he prescribes a treatment, it is the most beneficial for you and the one that's going to make you happy. Because there are a lot of times where you might have pain, you might not like the way a tooth looks, and let's say, for example, he has to do a root canal, and he does a root canal on one of your front teeth, and you don't like the ways the other look. So now when he gets the crown and he puts it on, it's gonna look good, but the other teeth are gonna look the way they look, which you don't like. So then to you, it's gonna bother you even more. And in some situations, um, when a doctor doesn't know if you don't like the way your teeth look, or if you don't like the position that they're in, so on and so forth, then a lot of people end up blaming the dentist in those situations. It's not that, it's that they just don't know. Now, if you inform the dentist and he doesn't do anything to take care of you, then my suggestion would be to go get a second opinion. And there's nothing wrong with second opinions, because the most important person when it comes to the medical field is the patient. Um, so yes, it's very important to inform your dentist when you go to your practice. Number two is, and this is very important for multiple reasons, is to make sure that you have your social security number. The reason why is because not only for insurance, because there are sometimes you might not know um, your member ID for your insurance company, and they, and to not waste time and not have to come back the next day, it is very important for you to know your social security number, because that is a way where the dentist can find through insurance your insurance information. In addition to that, if you have any treatment that you have to do, and sometimes treatments can be costly, especially if you want an extensive treatment, like you want a full month reconstruction, then you might have to apply for financing, maybe. And in those situations, the financial institutions do require your social security number for them to check your credit, or sometimes do soft checks. Sometimes they don't do hard pulls, and soft checks don't affect your credit. It's more of a simple way of the financial institution checking very lightly to see if you do qualify for financing or not. Um, so yeah, it's very important to bring your social. It doesn't have to be the physical card, but you should know it at the very least. Number one, and the most important thing that you should bring to the dental office, is yourself. A lot of people make appointments and they tend to not come. And it doesn't matter how many appointments you make, if you don't come, the dentist cannot take care of you. Now, I know that there are a lot of people that are paranoid of the dentist. It is a very common thing, that people are more scared of going to the dentist than they are going to the clinic when they're in labor. It's kind of funny how many people tell me that they would rather die than go to the dentist. I'm like, Jesus. And some people even told me that they'd rather speak in public than have to go to the dentist, because a lot of people associate dentists with pain. And while, if you're in pain, or if you have something that you notice in your teeth, the first place that you should go to is the dentist, and you should go to the dentist immediately. The reason why is because if you prolong things that are in your mouth that you know are there, and the longer you wait, the more expensive they can get. And yes, while if you try to minimize cost and you start losing your teeth little by little just because you want to minimize cost in the future, later in the future, your treatment, which might end up just being two dentures, is going to be cheaper. It is cheaper to get your teeth pulled out little by little as time progresses, and then when you get older, get dentures. That is true, but you're not going to be happy. You're not going to like it, and then you're going to get fed up with it. You're going to get tired. You're going to get tired of your dentures falling out of your mouth. You're going to get tired of the frustration of not having to like it, of having, when you go to sleep, having to take them out to clean them, and and having accidental mishaps when you're on when you're out and about. And then you're gonna get frustrated and be like, you know what, I'm just gonna get implants and get my dentures situated. And then you go from having to save money to all the money that you saved throughout the entirety of your life to not getting implants and spending 40, 50, even $80,000, depending on the condition of your mouth, and potentially even more. And then you have to get accustomed to that, because one thing that people don't take into account is getting used to things. You're used to having your teeth in your mouth because since you were a little baby, they started growing in your mouth, and you don't remember what those experiences were like, but you do know that you have your teeth in your mouth and you're used to them being in your mouth. Now you go from that to not having any, to getting used to a denture. And then you go from that to wanting to get implants, to getting used to having implants in your mouth, because they're not the same feelings. And these are things that you have to get used to. What's the easy way around all of that, and how to save money really in the long run, is to go to the dentist, take care of things in their initial phases as much as possible, take care of yourself, educate yourself with oral hygiene, and that's really the best way that you can do, the best thing you can do. And it's really the best thing you can do to make sure that you reduce cost and you're happy. More important than anything, you are happy in your later lives, because I have a lot of people that come to my practice and they tell me, oh, it's just, when I get older, I'm going to lose all my teeth anyways, and I'm just going to get dentures. So what's the point? And that's not true. I know a lot of patients that are in their 90s. I've had people here that are 100. God bless their soul, and they have all their teeth in their mouth. And there's ways of you not losing your teeth. And they're very simple and they're very cost effective. Oh, and before I go, given the current situation, the bonus thing that you should bring to your dental practice, if you have an appointment for any emergencies, is to make sure that you bring your face mask. And if you have gloves, bring your gloves. It is important to wear those because you want to try and prevent the spread of the current pandemic as much as possible. So that is all for today. In the next coming episodes, I'm going to be going over crowns and many other things on a more detailed form than what I said before. So as always, flourish and prosper.